Okay. Well, good morning. Good morning, everyone. It's great to be at the beautiful cliffs here at Kangaroo Point on this beautiful summer's day in Queensland with the Commissioner, Katarina Carroll, and the Deputy Chief Health Officer, Dr. James Smith. Well, Queenslanders, we have 15 hours to go. There's only 15 hours to go before Queensland borders reopen. And that's going to mean more people coming to Queensland from southern states for holidays, which will be great for our tourist industry, our tourism industry. It'll be great for business across the state, but it'll also mean more Queenslanders can reunite for Christmas. And that will be a wonderful thing for Queensland families. But it also means that COVID is coming to Queensland. And we've already seen that this week with cases being identified on the Gold Coast. Now, the Gold Coast, of course, will be at the front line of what happens with COVID as the virus arrives in Queensland. So the higher the vaccination rate across Queensland, but particularly on the Gold Coast, the safer we will all be and the better it will be for the Queensland economy. Can I just say today, and I'll let James Smith speak a little bit more about this, there's only one overseas acquired case in Queensland today, which is very good news. But of course, these days won't last. These days will finish soon as the virus comes to Queensland and the number of cases in our state grows. So the single biggest way we can protect ourselves, our families, Queensland businesses and the Queensland economy is to get vaccinated. Now, vaccination rates in the last 24 hours, we have 88.22% of Queenslanders with one dose of the COVID vaccine, and we have almost 81% of Queenslanders fully vaccinated. That's 80.98% of Queenslanders fully vaccinated. The flip side of that coin is it means there are 19% of the eligible group who are unvaccinated, and that presents some challenges. So the single biggest pathway to success for our state in the future is for Queenslanders to get vaccinated. Speaking of success, Queensland's health response has enabled, of course, one of the strongest economic recoveries in Australia. In fact, our health response has enabled a world-leading economic recovery, and that's been seen in job creation. Since the pandemic really struck in March 2020, over the last 18 months, we've seen 90,000 additional jobs created in Queensland. More jobs than any other state. In fact, more jobs than all states combined. And Treasury forecasting today shows that there'll be more good news for Queensland. So in the 18 months to March 2023, so in the 18 months to come, we're going to see the creation of an additional 120,000 jobs in Queensland. We've helped lift the Australian economy out of recession, and that will continue in the future with jobs growth that will lead the nation, we hope. Of course, we see what happened in New South Wales and Victoria with months and months of lockdowns, which has crushed their domestic economy. Budget deficits for the current financial year are likely to be about $20 billion in both states. I'll have more to say on the financial position of the state later in the week when I do the budget update, the mid-year fiscal and economic review. But with a budget deficit of the financial year just concluded on the 30th of June this year of $937 million, less than $1 billion, we are absolutely headed in the right direction. So on all the major economic indicators, Queensland is either better than the national average or we are leading the nation. And we are doing everything we can to keep us in that position. But Queenslanders working together, we can ensure we can continue to lead the country if we all get vaccinated. And on that point, I might hand over to Dr. Smith to say a few words about where we are today with COVID cases. And then I'll ask the Commissioner, Katarina Carroll, the Commissioner of the Queensland Police Service, to say a little bit more about the arrangements for the border opening that will happen at 1 a.m. tomorrow morning.
Thank you very much, Treasurer, and good morning, everyone. Well, I'm pleased to say that today we're announcing just one new case of coronavirus infection. That's in a man who's in his 30s, who has recently arrived in Australia from Nigeria. So given the African connection there, we're very closely following his genomic sequencing results, which should be available in the next day to 2 days. Obviously very interested in whether this may be Omicron. So otherwise we've got 46 active cases, I'm sorry to say, and our total case number is 2,169. Over the past 24 hours, we've had 11,918 tests done. So that's a reasonable number. We've also seen an uptick in the Gold Coast, where we've seen around a doubling in test numbers within Queensland health facilities over the last couple of days. But we really want to put a shout out to people to continue to get tested. It's really important as we move into this next era of the coronavirus pandemic that people are particularly vigilant, and so I'd remind anyone who has any symptoms at all of coronavirus to please come forward and get tested. The other thing to mention for today is QR code data, so Queensland check-in app. Anecdotally, we've heard that people are perhaps slackening off a little bit with regard to checking in and using their check-in apps. We really want to remind people to continue to do that whenever they enter a venue, whenever the app is presented to you. Please check in. That's the way that Queensland Health can follow up with you if the venue that you're entering happens to become an exposure site. Thank you very much. I'll now hand over to Commissioner Carroll.
Good morning everyone, and welcome to this beautiful part of the world. As you've heard, 1 a.m. Monday morning, December 13, travellers from interstate hotspots can arrive by road and air provided they are fully vaccinated, provide evidence of a negative test in the previous 72 hours, complete a border pass, and obviously, as you know, get a test on day 5. The border pass system will go live at various stages, and this is incredibly important because there is an operational shift, a different posture, there is a technical change, but also a legal change. So as of 8:30 tonight, there will be the X Pass, and that's the border zone residents. As of 10 p.m, an international pass, and as of midnight, the G Pass, the one that comes from the hotspots that I've just spoken about. Can I ask people to be patient and plan ahead, to travel outside of those peak hours if we can, and to ensure that you do have your correct pass. If you can't print it, that's fine. Just make sure that it's, on your phone as you're going through. And when you do get the opportunity to print it, please do, put it up on the dashboard or somewhere where it can be clearly displayed. I ask that you be truthful on your passes. Many instances we've had where people have been reported for not being truthful and not telling us, what the truth is. And as a result, there is obviously heavy fines if you aren't. It is end-to-end compliance, and we will be in many instances doing 100% compliance or random intercepts. So please don't think that you'll come to the border and you will easily get through. It is a case of there is a compliance system in place, and obviously those checks will be carried out. Thank you, and I'll speak to any questions when the Treasurer gets up again. Thanks, Treasurer.
All right, now who would you like to ask questions to? Commissioner, yes?
Yes. Yes. So it's been very difficult to estimate how much the road borders in particular will increase by. But I know I could safely say anywhere between 20 to 40 or 50,000 additional vehicles. We don't know exactly whether people will be coming immediately or will delay their trip for a couple of days. We do know there isn't many international flights, and I'll give you an example of that. The first international flight under the new system is not until tomorrow at 5 p.m, and there's only 12 people. In terms of domestic borders, I am not 100% sure yet. That changes constantly. But I think really in the next 24 hours we'll have a better sense, when people will move. Can I ask people that you cannot come to the border before 1 a.m. under the new system, because you're making a declaration, a legal declaration from 1 a.m. So if you turn up beforehand, it is under the old direction and you will be treated legally under that old direction. So pretty well everything happens from 1 a.m.
Are you expecting a massive influx of people to be using the website around that midnight 1 a.m. mark? And what contingencies are in place for crashes?
Yes, certainly we have our technical people already on standby. I've just been speaking to them this morning, ready to go. I am confident that the system will handle this. We've had a lot of shifts in recent times that have been well tested, so we're ready to go. But really from 8:30 onwards, particularly that border zone, can start getting their new pass, and we're well practiced at that. Remember also in the border zone that if you are unvaccinated, those current restrictions will stand. So it just changes really for the vaccinated people. If you're travelling particularly in those busy periods, like peak hour, you can expect extensive delays. In the past, we've actually seen delays of a couple of hours. I ask that you try and travel outside of those traditional peak hours. That will assist, obviously, those people travelling, but also the police on the borders. The catchphrase has been pack your patience, particularly for the first couple of days. When we see a big shift like this, it is a bit clunky. It's new, it's different, and a lot of people want to come in at once. So that's why in the first couple of days, please particularly be very, very patient.
Do you have any estimates on how many of those are tourists, how many of those might be residents, how many people are coming to stay?
There's a combination of many. There is definitely returning residents, and we know many people chose not to come in under the old directive, knowing that at 80% the directive would change. So we're expecting anywhere up to about 10,000 just in that group alone. But certainly I think many, many tourists can't wait to get into the state as well. So with the combination of all of that, a conservative estimate over the next few days is the tens of thousands.
Well, I'll have to take advice on that from our health professionals on that. Dr. Smith may want to say a little bit more, but we'll obviously have to give consideration to how that's going to operate. Well, I'm not going to be commenting on what other states do. Western Australia, of course, has done their very best to handle the virus the very best they can. Very low numbers of cases in WA, very low impact on their state, and along with Queensland our two states have had the strongest performing economies in the country. So I'll let WA make their own decisions. We've got a lot on our plate at the moment as our borders reopen, and we'll continue to focus on what we need to do for Queensland. But what we've seen over the last 18 months, since March 2020 or thereabouts, we've seen employment growth strongly occurring across Queensland. And that's been one of the benefits, or one of the silver linings of the COVID cloud, has been strong economic activity and strong jobs growth across Queensland. We look at places like Mackay in the north of our state, where we've seen unemployment drop below 4%. So we've had very strong employment growth across Queensland. These are global figures for our state. Obviously, there's a large population and large economic activity in the southeast. We'll also see, we hope, jobs come back in our tourism industry, which of course is our tourism businesses have really struggled over the last 18 months. But with the borders opening tomorrow, that will change. The bottom line is we're continuing to see jobs growth in Queensland, building on this great platform we've created for Queensland, and that's going to be terrific for opportunities for families, for individuals, and for regional communities as well.
What industries do you expect to see these jobs?
Oh, it'll be across the board. It'll be across the board. Obviously, we've had strong growth in construction. We've had strong jobs growth in construction across Queensland. Retail activity's been very high. Certainly, dwelling investment's been extraordinary across Queensland, so detached homes. So that will continue. Manufacturing, we've had jobs growth in manufacturing as well, which is of course one of our focus areas as a government to support creating more products, making more in Queensland by Queenslanders for Queensland. So in those areas, manufacturing, retail, hospitality and construction, we aim to see jobs growth across the state. For 2021, so 30 June, in December last year, we forecast a budget deficit of $8.3 billion when I did the December budget. When we did the budget in June this year, that had narrowed to $3.8 billion, and when I tabled the report on state finances, which are the audit accounts of the state, in September this year, or thereabouts, I think it was the end of September, the budget deficit came in at $937 million. And the single biggest reason for that was our strong health response. It allowed businesses to continue to operate, and that has allowed our economy to recover. We're looking to secure that recovery over the next 3 years as we look forward to the forward estimates, as we look across to the forward estimates, but I'll provide you with a detailed update, but we're heading in the right direction. I'll provide that update later in the week. Oh, look, we've forecast deficits all the way through to 24-25, and returning to surplus in 24-25 has been a strong commitment by our government. We're still dealing with the cost and consequences of COVID, but through this time of trial, we've seen limited impact on the health of Queenslanders when we look at what's happened in New South Wales and Victoria, and we've seen a smaller impact on our budget and on our economy when we compare it to New South Wales and Victoria, our major comparator states on the East Coast. So we want that to continue. Vaccination's the key, and keeping each other safe and protected will help our state and our economy in the future.
Yesterday, the government announced the change to close contact if you're fully vaccinated. How's that going to apply to children who are unvaccinated? Are they still going to have to quarantine for 14 days?
I'll let Dr. Smith respond to that.
Apologise, I found it a little bit hard to hear over the traffic noise. You might have to...
Yesterday the change was announced that if you're fully vaccinated and you're in close contact, you only have to isolate and quarantine for 7 days. What's it going to mean for children who presumably will still be unvaccinated?
Yeah, at this stage, children who are unvaccinated will have to continue to quarantine for 14 days. So there is still a couple of weeks, though, till that policy comes into place, and there is the opportunity for discussion over the next couple of weeks. There's a few fine points that will need to be worked out, but at this point, children will need to quarantine for 14 days.
And before I was just asking, you might be able to answer this now. Children going to venues and whatnot now, will they need to be double vaccinated given that they can get their vaccination now?
No, so it applies to 16 years and over. So for children, even if they are in the age eligible category, they still won't be under that particular requirement, given that the age eligibility is a relatively recent thing, and the vaccination program has predominantly focused on 16 years and over.
Will that change at some point?
Look, it may do, but I not aware of any discussion about that changing in the near future. I can't see it being next week, but it will be imminent, and this is why we've been saying there's no Freedom Day, right? Like it is a case that we absolutely need to prepare for cases. It will be difficult. There will be strain placed on the health system. The health system's very well prepared. They've been doing their level best in terms of our Queensland health hospitals and the health sector more broadly to prepare for it. But we will have cases, and we're not at the point of living with COVID anytime soon. It's probably at least 6 months or so away at an absolute minimum before we can comfortably say that we'll be living with COVID.
One more statement. This is James Maestro today. In terms of those job figures and the number of people coming over the border, do you expect a lot of them to want to build their homes or renovate their homes?
Yeah, that's been one of our challenges, obviously. One of the unanticipated consequences of COVID, the strong demand for dwellings in Queensland, which has impacted, of course, on the affordability of housing. And we've obviously done our bit as the government, putting in almost $3 billion in our last budget to support the growth of affordable and social housing in particular. But look, at the end of the day, we want a growing economy. That is good for jobs, it's good for economic activity, it's good for opportunities for Queenslanders. And so there will be people who want to relocate to Queensland precisely because we have handled the pandemic so well. They see Queenslanders as a place to build a future, as Queensland has always been, a place for people to come and start a life, to start a family, to grow a business and to build a future. And we want to be that beacon to other parts of the country and other parts of the world. We have something special in our state. We need to work hard to protect what makes Queensland special, but we will also have people arriving here and we have strong population growth. On balance, that is really good for our economy, but we of course have the challenge of growth too, and we're focusing very strongly on that as a government. Marlene, I'll update you later in the week, so we'll have some projections on our fiscal position later in the week, which will include some updates on revenue for the state, but obviously population growth results in an increase in revenue because of economic activity, the transaction of homes or the dwelling houses, which means higher stamp duty, registration fees, those sorts of things, land tax and so on. So I'll give you an update later in the week, but there will probably be a revenue increase, but of course we're still dealing with the cost of COVID, and that will continue in the future too.
Do you have any projections on how many tourists want to come here next week or
No, I don't today, but we know that the number of tourists will of course grow. We are a tourist mecca, particularly for states like New South Wales and Victoria, and with the border arrangements changing from 1 a.m. tomorrow, we know more tourists will come to Queensland, which will be good for those tourism operators, particularly in the Christmas New Year period. All right, thanks very much for your time today. Really appreciate it.
It's hard enough to get